All right, let's jump right in. Welcome to today's Explainer, where we're going to unpack a truly fascinating yet incredibly serious medical phenomenon. If you really think about it, the human body is basically an incredibly complex, highly efficient plumbing system. It's constantly moving fluids around, perfectly balancing pressures, and draining out the waste. But what actually happens when that masterfully designed system just completely and utterly breaks down? Well, today we're exploring exactly that through a condition called Anasarca.
To hook you right from the start, I want you to imagine a scenario of extreme, literally catastrophic fluid retention. We're not just talking about feeling a little bloated after a super salty meal. No, we're talking about a frightening level of fluid accumulation that seemingly defies gravity, where tissues all over the body just become completely engorged with trapped fluid. It's basically a massive internal flood, and it completely alters the body's entire landscape. The clinical term for this systemic overload is Anasarca. It's defined as a severe, generalized fluid accumulation in the interstitial space, which, by the way, is just the space right between your cells. What's truly fascinating here is the sheer volume involved. Anasarca usually only becomes clinically obvious after a massive amount of fluid, often blowing past 2.5 to 3 liters, has leaked right into those tissues. To put that into perspective, just picture having to carry around 2 or 3 large, heavy bottles of water trapped just beneath your skin and organs.
To really understand the stakes here, we need to contrast it with something you're probably way more familiar with. You've likely seen localized edema, like a swollen ankle after a long flight, right? Well, if you have a swollen ankle, you usually just elevate your leg above your heart, and gravity magically helps drain that fluid back into your circulation. But Anasarca? It's a generalized extreme swelling. Because the body's entire systemic balance is broken, simply changing your position or elevating a limb does almost nothing to relieve it. Basically, gravity just can't fix a broken pump.
Section 1. The Physics of the Flood. Starling Forces at Work.
So how in the world does this happen? Let's transition into the actual mechanics of how the body maintains its fluid balance and what exactly goes wrong to cause such a massive flood. The secret lies in something called Starling forces. Now that sounds like astrophysics, I know, but it's actually this brilliant biological balancing act. Imagine your blood vessels. Step 1. Hydrostatic pressure, which is essentially the water pressure generated from your heart pumping, pushes fluid out of the blood vessels. Step 2. Oncotic pressure pulls that fluid right back in. This pulling force is created by proteins in your blood, primarily one called albumin, and they act like millions of tiny sponges holding water inside the vessels. Step 3, when these push and pull forces are perfectly matched, you're healthy. But when that delicate balance shatters, fluid shifts straight out of the vessels and just floods the tissues.
Another huge piece of this plumbing puzzle is your lymphatic system. Normally, your capillaries leak a tiny, manageable amount of fluid into the tissues, and your lymphatic drains act like a sump pump, quietly clearing it away in the background. Anasarca happens when this delicate equilibrium is totally shattered. Either the capillaries are just dumping fluid into the tissues way faster than the lymph nodes can possibly drain it, or the lymphatic drains themselves are completely blocked.
Section 2. The usual suspects. Finding the root cause.
So, if the plumbing is broken, who broke it? Let's bring in the major organs responsible and interrogate the usual suspects. First up, the heart. If a patient has heart failure, the pump is weak. Blood backs up, which drastically increases that hydrostatic pressure, essentially forcing fluid out into the tissues. Next, the kidney. Conditions like nephrotic syndrome cause the kidneys to inappropriately filter and just lose massive amounts of protein straight into the urine. Finally, the liver. In conditions like cirrhosis, a damaged liver literally stops producing enough albumin. Both kidney and liver failure lead to decreased oncotic pressure. And remember, those are the sponges holding fluid in the blood. Without them, the fluid has nothing holding it back, so it just leaks right out.
So, the absolute crucial takeaway here is this. Anasarca is not a standalone disease. It's actually a symptom of an underlying medical condition. It's a massive, flashing red siren from your body. It's telling doctors that a major internal organ, whether it's the heart, the kidneys, or the liver, is waving a white flag and actively losing a hidden battle.
Section 3. The detective work. Diagnosing the cause.
Now, knowing the usual suspects is one thing, but how do medical professionals actually solve this mystery in real life? Well, let's look at an actual case study documented in the medical literature. Picture this. A 60-year-old male presents at the hospital. His chief complaints? He's got bilateral lower limb swelling, really noticeable facial puffiness, abdominal discomfort, and severe breathlessness that has been steadily worsening for a whole month. He's also experiencing orthopnea, which, by the way, just means he literally can't breathe when he lies flat, and there's a really concerning decrease in his urine output. I mean, this is textbook Anasarca, right? But what is the actual cause?
This is where doctors start looking for specific diagnostic clues. They might perform the temporary dimple test, basically pressing firmly on the swollen skin. If it leaves a physical indentation, that's called pitting edema, which is a classic sign of fluid shifting under pressure. They'll also look for ascites, which is fluid pooling directly in the abdomen, and that points heavily toward liver issues. They'll check for pulmonary edema, or fluid trapped in the lungs, which is what causes that severe breathlessness and points right to the heart. And, of course, they run blood tests, specifically checking for severely low serum albumin levels, which often drop below 2.5 grams per deciliter in these cases.
Let's look at another clinical scenario from the sources where Anasarca presents as an apparently terminal marker of advanced heart failure. To actually prove this, the medical team needs to literally catch the culprit in the act. And they do this using ultrasound imaging of the heart, which you probably know as an echocardiogram.
As you can see, this brilliantly illustrates exactly what doctors are looking for during that detective work. What we're looking at is a B-mode echocardiogram from a patient. Those green and blue outlines are tracing the left ventricle, carefully measuring what's called the ejection fraction, or EF for short. The ejection fraction is simply the percentage of blood the heart successfully pumps out with every single beat. A normal, healthy pump should be squeezing out a really good volume, but doctors use this exact imaging to see if a failing pump is the actual reason all that fluid is backing up and flooding the body.
So, when the echocardiogram displays a noticeably reduced ejection fraction, like the 43% we're seeing here, it definitively proves that this patient's struggling heart pump is simply failing to clear the body's plumbing. The pressure backs up, the capillaries start to leak, and boom, Anasarca sets in. It's the hard visual evidence of the mechanical failure driving the entire symptom. Section 4. Fixing the leak. Treating the source.
All right, once the detective work is done and the culprit is confidently identified, the immediate question becomes, how on earth do we fix it? We move right into the treatment phase, focusing on stopping that flood and addressing the root cause. The treatment is basically a multi-pronged approach to essentially bail out the water. The first line of defense is usually high-dose loop or thiazide diuretics. You probably know them as water pills. These medications literally force the kidneys to push excess fluid and sodium out through the urine. Alongside this, patients are put on very strict sodium and fluid restrictions. Now, if protein levels are dangerously low, doctors might use IV albumin infusions to put those microscopic sponges right back into the blood. And in the absolute most severe cases where the kidneys just aren't responding at all, mechanical intervention like dialysis or ultrafiltration is required to physically filter that fluid straight out of the blood.
But the overarching theme here is incredibly simple. You cannot just bail out the water on a sinking ship. You absolutely must fix the broken pipe. While diuretics provide critical, often life-saving relief by reducing that massive fluid volume, true resolution of Anasarca requires directly treating the underlying heart, kidney, or liver disease that caused the imbalance in the very first place.
Because of this, the prognosis for a patient dealing with Anasarca is entirely dependent on that underlying cause. If the condition is brought on by, say, a specific medication or an acute infection, the prognosis is actually quite good. You just stop the drug or cure the infection, and the Anasarca totally reverses. However, if the Anasarca is a late-stage marker of chronic, advanced heart failure or severe liver cirrhosis, it represents a very, very grave clinical challenge. The outlook really depends on whether that broken pipe can be permanently repaired.
So, we've seen how a breakdown in hydrostatic and oncotic pressures can literally turn the body's plumbing into a catastrophic flood. It's a vivid, frankly wild reminder of how intricately balanced our biology really is. So, I'll leave you with this. The next time your body undergoes a strange change or develops some new, unusual symptom, ask yourself, is this the actual disease, or is it just a warning siren for a hidden internal battle? Thank you so much for exploring the science of Anasarca with me today, and as always, keep questioning how your amazing body works.